where we learn together how to live joyfully, healthily, and independently, even when we are living alone. I am your companion today, and I am so glad you stopped by. If this is your first time visiting the channel, feel free to hit the subscribe button and turn on the notification bell so you do not miss any valuable health tips. And if you have been following this channel for a while, please leave a hand wave emoji in the comments to let me know that you are still here, still walking this journey with me. Today, we are going to talk about a situation that no one wants to face, but everyone needs to prepare for. That is if one day you are alone and start to feel short of breath, weak, and have a dull pain in your chest. You suspect a heart attack is coming. There is no one around. What would you do? According to the American Heart Association, up to 50% of deaths from heart attacks in older adults happen within the first hour, and many of those cases occur when the patient is alone at home. But do not panic. The good news is just by knowing a few basic steps, your chance of survival can increase significantly. You do not need complicated medical techniques. You just need to know how to stay calm, how to listen to your body, and how to take small actions at the right time. And that is exactly what I'm going to share with you today. 7 steps, 7 ways to help you survive when a heart attack strikes and no one is around, especially at the end of this video. I will share a simple but extremely effective tip to help you stay calm and keep your heart steady during the most critical moments. So please watch until the very end. Do not leave halfway through, because what you hear in the last part could be what saves your life or the life of someone you love. Before we begin, if you find this topic important, please leave a comment with the country you live in and your age. That helps me better understand you and create more helpful content for you. Many people still believe that a heart attack strikes like in the movies, with someone clutching their chest, collapsing to the floor, face turning pale, and gasping for help. But in reality, it is often very different. For most older adults, especially women or those with chronic health conditions, a heart attack can begin in a surprisingly quiet way. It does not come like a thunderclap, but more like a gentle rain. The problem is, if you do not catch it in time, you might not get a second chance to make it right. One autumn morning in Ohio, Robert, age 74, woke up feeling like there was weight pressing on his chest. It was not sharp pain or intense tightness, just a sense that a sandbag was resting on his chest when he tried to take a deep breath. He also noticed slight shortness of breath and a chill in his fingertips. On a normal day, he might have ignored it, thinking it was just the weather changing. But that day, he remembered something he had heard in a local health program. Not all heart attacks feel the same. So, he called for emergency help. Thanks to that decision, his heart received timely treatment, and he avoided permanent damage. According to the National Heart, Lung, and Blood Institute, NHLBI, up to 30% of heart attacks in older adults do not come with the typical chest pain. Instead, they may show up as unusual fatigue, cold sweats, dizziness, nausea, jaw pain, or upper back pain. In women, the only sign may be pain in the stomach area or discomfort below the breastbone. The key is to never ignore strange signals from your body, especially when you have more than one symptom at the same time. If you feel heaviness in your chest, shortness of breath, unusual tiredness, or unexplained dizziness, do not try to tough it out. Consider it an urgent warning, because your body always knows first, and it is trying to tell you something. When you begin to feel unusual signs like chest pressure, shortness of breath, or dizziness, and your instincts tell you something is wrong, the first thing you must do is call emergency services. Do not call your son, your neighbor, or anyone close to you. Call the medical emergency line directly, because in a heart attack, time is life, Every passing minute means more heart muscle being damaged due to a lack of oxygen. Only trained professionals can step in quickly enough before it is too late. Linda, age 78, living in Arizona, once faced such a life-or-death moment. One afternoon, while watching television, she suddenly broke into a cold sweat, felt a slight numbness in her left arm, and a wave of nausea. At first, she thought about calling her son, but then remembered what a nurse had once told her during a checkup. If you suspect a heart attack, call 911 first. She did exactly that. By the time the ambulance arrived, her heart was already showing signs of irregular rhythm, but because she called early, the emergency team was able to act in time, and she was saved. You might think calling an ambulance is an overreaction, but the truth is, no one will blame you if you are wrong. On the contrary, emergency responders would rather arrive too early than too late. If it turns out not to be a heart attack, you have only lost a few minutes. But if it is, that call may be the only thing that keeps you alive. Another important point is this: do not drive yourself. Some people think, I will just drive to the hospital, but that is a dangerous decision. You could lose consciousness on the way, cause an accident, delay your own treatment, or even harm someone else. Sit still and let the professionals come to you. They bring equipment, emergency medication, oxygen, and can start treatment right there in your home. You should set the emergency number as a speed dial on your phone. Some smartphones have an emergency call feature that works even when the screen is locked. Always keep your phone close to where you usually sit or sleep, especially if you live alone. Just one call, at the right time, to the right people, in the right place, and you could save the rest of your life. In the first few minutes when you suspect you are having a heart attack, after calling emergency services, there is one simple but extremely important action you can take at home. That is, chew an aspirin tablet. Not swallow, but chew, because this action helps the medicine work faster. Thin your blood, reopen blocked arteries going to the heart, and reduce the damage to the heart muscle that is already happening. According to the American Heart Association, aspirin is not just a common pain reliever. It also helps prevent platelets from clumping together to form blood clots, the main cause of heart attacks. When you chew aspirin, it is absorbed through the lining of your mouth, enters the bloodstream more quickly, and works faster than swallowing the pill whole. Daniel, age 72, from Florida, is a living example of this. That morning, he felt tightness in his chest, a light tremor in his hand, and a dry throat. He did not panic. He went to the kitchen drawer, grabbed the aspirin bottle he kept there since watching a community health talk. He chewed one 325 milligram aspirin tablet, then sat down and called 911. When he arrived at the hospital, the doctor said that one small pill had significantly limited the damage to his heart. However, not everyone can take aspirin. If you are on special blood thinners, allergic to aspirin, or have a history of severe stomach ulcers, you must talk to your doctor before using this method. Also, avoid using enteric-coated aspirin if possible. If that is all you have, you can still chew it, because saving your heart is the top priority. Here is one small but very important tip. Keep aspirin in multiple places where you spend time. By your bed, in your coat pocket, wallet, or kitchen. Label it if needed. Tell your children or loved ones where it is stored, and do not let the aspirin expire. That small pill might be the only thing standing between you and a permanent goodbye. Have you ever kept aspirin in your home or wallet? If not, today is the time to start. In the moment a heart attack begins, there is one seemingly simple action that plays a critical role. Stop everything you are doing and sit or lie down immediately. Do not try to grab anything. Do not tidy up. Do not open the window. Your body is now facing a serious lack of oxygen. Every movement forces your heart to work harder, and that can make your condition worsen very quickly. Ideally, sit on a chair with back support. Place your feet flat on the floor, relax your arms, and keep your head upright for easier breathing. If you feel dizzy or about to faint, lie on your side with your head slightly elevated to keep your airway open. Avoid lying flat on your back, especially if your chest feels heavy, because this may cause breathing difficulty. Also, do not bend forward or hunch over, as that adds more pressure on your heart. Carol, age 81, living in Seattle, is a meticulous and independent person. One morning, she felt heaviness in her chest, cold sweat pouring out, and shortness of breath. Her first thought was not to call for help, but to clear the breakfast table and wash the dishes first. But as she stood up, she became dizzy and nearly collapsed. Fortunately, she sat down in time and called 911. The doctor later told her that if she had taken just a few more steps, the heart attack could have turned into cardiac arrest. According to the Centers for Disease Control and Prevention, CDC, sitting or staying still after heart attack symptoms appear is a key factor in reducing the body's oxygen demand. This helps prevent a sudden spike in heart rate and blood pressure, giving your body a chance to stabilize while waiting for emergency care. If you are at home, do not worry about being tidy or polite before someone arrives. Right now, survival is the most important thing. The only thing you should focus on is staying still, keeping the most comfortable position possible, breathing slowly, and allowing your body to focus on one task only, keeping your heart beating. Have you ever had a moment when you had to stop everything because something felt wrong? If you are still conscious and feel strong enough to move after calling for emergency services and sitting down to rest, there is one more important thing you should do right away. Open the front door of your home. It may sound simple, but in an emergency, this action can help medical responders reach you faster, sometimes just in time to save your life. In a study by Johns Hopkins University, cases where the front door was locked caused emergency teams to lose an average of 1 to 3 extra minutes trying to get inside. That time may seem short, but during a heart attack, every second is precious. There have been many cases where patients lost consciousness just minutes after calling 911, and the delay caused by breaking in made survival impossible. Paul, age 76, lives in a small apartment in Texas. He shared that his habit of keeping a spare key near the door and opening it immediately after calling emergency services allowed the medical team to enter his home in less than 30 seconds. They were able to give him a heart-stimulating injection and take him to the hospital while his heart was still beating. If you live in a gated community or on a high floor in an apartment building, think ahead about support options. You can install a lockbox outside your door, keep a key inside, and share the code only with trusted people or emergency services. A more modern option is to use a smart lock that can be opened remotely or give access to a trusted contact. For those with mobility issues, planning this in advance is even more important. Of course, if you feel too weak or getting up poses a danger, do not move. Stay seated, focus on breathing steadily, and wait for help. But if you are able and the distance to the door is safe, open it as soon as you can. That small action can save dozens of precious seconds, and sometimes those seconds are the last chance to keep you here with life. Have you ever thought about preparing a way for others to enter your home during an emergency? When you are alone and calling for emergency help during a suspected heart attack, your phone is more than just a tool to dial for assistance. If used wisely, it becomes a silent medical assistant that helps you stay connected, share vital information, and support emergency responders in acting quickly when you are no longer able to speak. The first thing to do is to use speaker mode. After calling for help, turn on the speaker so your hands are free and you can focus on keeping your breathing steady. When your heart is in danger, Even holding the phone to your ear can tire you out, increase pressure on your heart, and make it harder to breathe. Using speaker mode allows you to speak more easily and lets the emergency team hear background sounds, such as breathing, groaning, or even if you suddenly lose consciousness. These sounds help them assess your condition and guide you more accurately. The second important step, if you haven't done it already, is to set up emergency medical information on your phone. Both iPhone and Android devices have this feature. You just need to enter your name, age, blood type, any existing conditions such as diabetes or high blood pressure, drug allergies like penicillin, current medications, and an emergency contact number. This information can be accessed even when the phone is locked, allowing medical teams to make the right decisions without guessing in a time-critical situation. A powerful example is the story of Susan, age 79, who lives in Michigan. One night, she fainted just after calling for help. When the medical team arrived, she was unconscious and unable to answer questions, but thanks to her iPhone's preset medical profile, they knew she had diabetes and was allergic to penicillin, which helped avoid the wrong medication and allowed them to call her daughter right away. As a result, the treatment and follow-up care went smoothly, without complications. Setting up your emergency information takes about 5 minutes, but its value could last a lifetime. Do it today. Remember, in the moment you can no longer speak. Your phone may be the one speaking for you. Have you ever set up your emergency medical information on your phone? If not, would you like to try it now? When a heart attack strikes, feelings of fear, panic, and loss of control often arrive at the same time as the physical symptoms. You may feel your heart racing, your breath becoming rapid and shallow, and your mind spinning with the thought, "Am I about to die in that moment?" There is still something you can control, and it is incredibly important you're breathing. Slow and controlled breathing is not a cure for a heart attack, but it helps prevent the situation from getting worse. When panic sets in, your sympathetic nervous system is triggered, causing your heart rate and blood pressure to spike, which is very dangerous for a heart already starved of oxygen. On the other hand, if you focus on your breathing, your body can begin to stabilize, your heart will strain less, and you may gain precious time while waiting for emergency help. One simple yet powerful technique is called the 4-6 method. You inhale through your nose for 4 seconds, hold the breath for 1 second, then exhale slowly through your mouth for 6 seconds. Repeat this cycle. Count slowly in your mind. Focus on the rhythm. Let each breath be a quiet message to your heart saying, "Stay calm. I'm here with you." Frank, 83, who lives in Illinois, survived a heart attack thanks to this breathing technique. When the chest tightness struck, he felt dizzy and his hands began to shake, but he remembered a checkup months earlier, when his cardiologist had taught him to breathe slowly during times of anxiety. He followed the method, and after a few cycles, he felt less dizzy, could breathe more easily, and stayed alert enough to call for help. His doctor later confirmed that if he had panicked, his heart might have gone into arrhythmia or stopped altogether. You can practice this breathing technique every day while watching television, before bedtime, or during a quiet moment of rest. Training your body to stay calm through slow breathing is one of the best ways to prepare for an emergency, because in that moment, instead of freezing in fear, you'll know how to do the most important thing: stay calm to survive. Have you ever tried the 4-6 breathing method? Try it tonight before going to sleep. You may discover the quiet power of your own breath. When it comes to surviving a heart attack, many people believe it all comes down to luck. But in reality, the deciding factor is not luck. It is preparation. Preparation in awareness, in response, and in the smallest of actions. The 7 steps you just read are not advanced medical knowledge meant for doctors or nurses. They are simple things that anyone, at any age, can do if guided properly. And more importantly, the older we get, the more we need to take responsibility for caring for ourselves, especially if we live alone. You can start with small things. Keep a few aspirin tablets in the right place. Save emergency numbers in your phone. Practice the 4-6 breathing method a few times a day, or simply remember that any unusual feeling in your chest should never be ignored. We cannot stop the heart from aging, but we can help it fight better when crisis strikes. Every senior deserves to feel safe in their own home. And that safety comes from knowledge, from habits, and from listening to your body every day. This video is not something to just watch and forget, but something to apply, to prepare, to live proactively. Because no one knows what tomorrow will bring, but the one who is prepared always has a better chance of making it through. If you found today's message helpful, don't forget to subscribe to the channel and share this video with your friends or loved ones over 60. We will continue to bring you more videos about healthy eating, gentle exercises, better sleep, and natural remedies to protect your heart and well-being in later life. Which of the 7 steps are you already putting into practice? Leave a comment below and let us know that you are truly taking action for your own health, starting today, because sometimes just one small change can be enough to save